Equine neuroaxonal dystrophy, or equine degenerative myeloencephalopathy, is recognized as an inherited neurodegenerative disease. It is believed to be connected to a deficiency of vitamin E, particularly during the crucial first year of a horse's life. The clinical signs of this condition are quite characteristic, often presenting as a symmetrical lack of coordination, which veterinarians grade on a scale where a higher grade indicates more severe issues. Horses might exhibit a wide-base stance even when resting, show difficulties with their sense of body position, known as proprioceptive deficits, and typically have lower levels of vitamin E, specifically alpha-tocopherol, in their blood serum. Interestingly, even after a horse passes its first year, the concentrations of this crucial form of vitamin E in their blood tend to remain lower compared to healthy horses of the same age. The good news is that equine neuroaxonal dystrophy, or equine degenerative myeloencephalopathy, can potentially be prevented in foals that are genetically predisposed to the condition. This preventative measure involves supplementing the mares with high doses of a water-soluble form of alpha-tocopherol, specifically RR or alpha-tocopherol, during the final 3 months of their pregnancy. This supplementation is then continued in the foals themselves throughout their first 2 years of life. Currently, the only definitive way to diagnose equine neuroaxonal dystrophy, or equine degenerative myeloencephalopathy, is through a post-mortem examination. This involves a detailed histological evaluation of the brainstem and spinal cord after the horse has passed away. While scientists have recently developed a biomarker test that looks for phosphorylated neurofilament heavy chain in the blood serum, which has shown some promise in diagnosing equine neuroaxonal dystrophy, or equine degenerative myeloencephalopathy, its overall reliability is still considered low. In the realm of human health, there is a comparable inherited disease called ataxia with vitamin E deficiency, often referred to as AVED. This condition is caused by harmful variations in the gene responsible for the alpha-tocopherol transfer protein, known as TTPA. This protein plays a major role in moving alpha-tocopherol into the lipoproteins that are secreted by the liver and circulate in the plasma. Interestingly, research has shown that equine neuroaxonal dystrophy, or equine degenerative myeloencephalopathy in horses, is not associated with genetic mutations in this alpha-tocopherol transfer protein gene. However, the researchers in this study hypothesized that variations in other genes involved in how vitamin E is taken up by the body, distributed to different tissues, and metabolized, could potentially influence a horse's risk of developing equine neuroaxonal dystrophy, or equine degenerative myeloencephalopathy. This study identified a significant association between 2 intronic single nucleotide polymorphisms in the CD36 gene and equine neuroaxonal dystrophy, or equine degenerative myeloencephalopathy, in quarter horses.